Hello everyone, I hope that you all are doing great. Let's talk about assessment of clinical judgment. According to my understanding, the assessment of clinical judgment, which is ACJ, is the second exam of equivalency process. One can be eligible for this exam once they have passed and cleared their first exam, which is the assessment of fundamental knowledge or AFK. ACJ basically evaluates your ability to diagnose and make clinical decisions as well as assesses your knowledge in oral radiology and ability to interpret radiographic images. As per my knowledge, ACJ is about 5.5 hour examination with one scheduled 30-minute break. It consists of 120 to 150 multiple choice questions. These questions can be single answer or multi-answer type. As per my understanding, question type and format is actually different from AFK. This one covers case-based diagnosis, treatment planning, clinical decision making, and radiographic interpretation. So one will be presented with case that might be based on diagnosis or histories, dental charts, radiographic images, or photographs, and then one needs to answer the question based on the case they are given. This is probably to assess their skills. On the other hand, the most important part is the radiographic interpretation. Radiographic interpretation questions are designed to assess the proficiency in oral radiology and the ability to analyze radiographic images to make accurate interpretations as well as diagnosis. These radiographic types of questions test the knowledge of dental anatomy, pathology, and radiographic techniques. It might be required for the candidate to identify normal anatomical structures or detect abnormalities or pathologies and provide appropriate diagnosis based on the radiographic findings. One's expertise in oral radiology and their ability to apply that knowledge to interpret radiographic images will be evaluated through these types of questions. So it's a good idea to practice for such questions and be prepared to answer more than one answer in a single question. Again, as per my knowledge, the exam is administered electronically at Prometric test centers. This exam is conducted in Canada, Australia, and New Zealand. During the scheduling process with Prometric, candidates will be able to choose their preferred test center location. Also, the exam is conducted mostly twice a year, probably in May and November. Registrations for this exam is opened few months before the actual exam, and the best way to know about the registration dates and bookings or update is to keep checking the related website and their social media for updates. I highly recommend to view e-exam orientation before attempting this exam. Scoring for ACJ, as per my knowledge, is based on a test equating procedure. A score of 75 or higher is reported as pass, while a score below 75 is reported as fail. The results will include test equated rescaled score without further breakdown of results. As far as I know, one is allowed a maximum of 3 attempts for this exam. For more information and for more questions, I highly recommend to visit the Authentic Related website. I really hope that this video helped you in some way. Thank you very much. Have a great day. Goodbye.